Hi, everybody. And now that we've spent some time talking about the different systems of the human body, digestion, circulation, respiratory systems, and we touched upon some of the conditions that can develop within those different systems, and today we're going to start talking about medical imaging technologies. Now, you're all familiar with the microscope. You were using it in class, and we were looking at cells from our own body, human cheek cells, and we know that you can use the microscope to diagnose various diseases, but there are other imaging technologies that are available as well. And the reason we use them is because we want to see images not only of cells, but of tissues within the body and entire organs. What these imaging technologies allow doctors to do is take a look at what's going on inside the patient, diagnose any conditions that are developing, and treat them, and treat injuries and disease. The first one we're going to take a look at is X-rays. X-rays you're probably most familiar with. You probably know somebody if you have not already had one yourself. And it uses radiation through the body to make an image onto a screen, and it is usually used to observe hard tissue such as bones. So, for example, if you've got a fracture in your leg or a broken arm, it can diagnose these kind of injuries and also any malformations that are occurring as somebody is growing. Now, CT scans, also known as computerized axial tomography, is like an X-ray, except that you have a sensor that will rotate around the body and move along the length of the body as it's rotating, and then a computer will convert this image from the sensors into a 3D image, so it looks like it's taking pictures of slices of the body, and so it can make that 3D image. The nice thing about the computerized axial tomography is that you can view hard tissue, again, such as bone, like the X-rays, and diagnose bone injuries and malformations, but give you a 3D view of it. Now, ultrasounds, you may know somebody's an ultrasound, and when we think of ultrasounds, we think of babies in the womb, and you would be right about that. And this is a very safe way of taking a look inside the body without any radiation. Ultrasound uses sound waves at body parts, and it measures the reflected sound waves and makes an image. So this ultrasound could be used to view any soft tissue, and so you usually think of it as monitoring the development of babies in the wombs, but you can also look at organ function, and you can also use ultrasounds to detect cancer. All right. So here's an ultrasound machine on the left. If you've ever had an ultrasound on any organ within your body, you would be familiar with this. And of course, there's a picture of a baby, the ultrasound image of a child in the womb. An MRI scan, or magnetic resonance imaging, looks a lot like the last one we saw, but radio waves are passed through the magnetic field around the body, and we get multiple images on a computer. But instead of just soft tissue and hard tissue, it produces images similar to the CT scan, but shows on a lot more detail. And here you can see an image of an MRI of a knee, and it's comparing or contrasting the soft tissue around the knee and the hard tissue with the bones. Okay? So this allows you to diagnose disease in organs and soft tissues as well. Now, a PET scan, positron emission tomography, involves scanning small amounts of radioactive material. Now, they have to inject this radioactive material into the body, and as it scans you, it picks up that radioactivity and reveals the details of the tissues and organs you are trying to track. So, for example, if you take a look here, we're viewing soft tissues, and in this case, the brain. And in this PET scan, we're diagnosing cancer and tracking cancer treatments. And in the case of the diagram, we're taking a look at a normal brain compared to someone showing pre-Parkinson's syndromes and the changes that happened in the brain after Parkinson's disease has already manifested itself. Endoscopy is an interesting little device where a scope with a tiny camera, a light are attached to a flexible tube and is inserted in the body. And this allows us to take a look at the body parts in the body without actually having to cut open the patient, and allows us to be able to take samples, even perform surgeries, and as we take a look, we can diagnose diseases. This has really done an effective job in cutting down on the amount of time people have to spend in hospital just to be able to diagnose anything that might be wrong with them. You can get it done now internally, and you have minimal scarring, and it's almost always an outpatient procedure. Here are a couple of views of endoscopy. On the bottom right, you see an endoscope being used on a person looking inside, and on the upper left, you see the ear of somebody. You can see the bones of the ear. You would not want to cut somebody open to look at the bones of the ear, but if there was something wrong, endoscopy is the perfect way to be able to diagnose that. All right. So if we take a look at a couple of questions here, these are ones I'd like you to answer in preparation for tomorrow's class. Identify 3 general purposes for using medical imaging technologies. Question 2, here is something for you to think about. A 44-year-old male was brought into the emergency room after he fell. He cannot put weight on his ankle. Which technology would you be using on this male who fell? And number 3, a 16-year-old female has a suspected cancer tumor. What technology could you use to diagnose whether she does indeed have cancer or not? We'll talk about these tomorrow. Have a good night.